Today's webinar on ICRA Training, Meeting the Needs of Working in Healthcare Construction. My name is Jessica Bunting, and I'm the CPWR host and tech support for this event. So before we get started, I'd just like to go over a few things. First, if you have any technical problems with the webinar or the phone system, please contact me at jbunting@cpwr.com or 301-495-8515. That information is also written out in your chat box right now. If you're listening to the audio portion of this event through your computer and experience any lag or difficulty hearing the speakers, it might be because of your internet bandwidth, and we recommend that you use your phone to call in for improved sound quality. The call-in information can be found on your event info tab to the left of the presentation on the webinar screen, or if you just hit the little phone icon on the right of the screen, it will give you the option to connect a different way. We will take some time at the end of the presentation to answer your questions. Since your phones and microphones are muted through the system, you can enter any questions into the chat or Q&A boxes at any time. I will read the questions out loud at the end of the presentation. And finally, today's webinar will be recorded, so if you're interested in reviewing or sharing the information with colleagues, I will make that available to everyone via email after the event. Right, our presenter today is Gary Gustafson, CPWR's new Environmental Hazards Training Program Director. And with that, Gary, I will hand it over to you.
CPWR's Infection Control Risk Assessment, or ICRA Training. As Jessica mentioned, my name is Gary Gustafson. I'm the Environmental Hazards Training Director here at CPWR and your panelist for today's training, today's webinar. I'd like to start by providing some background information on who CPWR is. CPWR, or the Center for Construction Research and Training, is a nonprofit established by North America's Building Trades Unions, part of the AFL-CIO. We're active in three areas: research, training, and service, with a special focus on safety and health since 1990. And we serve as NOSH's National Construction Center, and proud to say that we are recognized worldwide for the work that we do, and we're very proud of that. So let's get started. So first of all, let's look at the health construction market before we get talking about ICRA training. According to a survey done in 2015 by Revista, an Annapolis-based company which tracks medical construction, healthcare construction nationwide is booming, with about $97 billion in projects for new hospitals, expansions, off-campus clinics, and medical offices currently underway. So it's a large part of the construction market here in the United States. In the fall of last year, Health Facilities Management and the American Society for Healthcare Engineering of the American Hospital Association surveyed a random sample of over 3,000 hospitals and health system executives to learn about trends in hospital construction. And here's what they found. Nearly 67% of the survey respondents said that they are either repurposing healthcare facilities or currently assessing space for other needs. So what does that mean? That means the potential for continued market growth in the healthcare industry is the future. This also means that we're going to be seeing a lot more construction workers working in these types of facilities. I do have to say the survey also found some precautions, which I'd like to raise. First, hospital construction growth is not happening nationwide. And second, states that have accepted federal funding to expand their medical programs and start the insurance exchanges are seeing more activity. And this may account for why all of you are not seeing the demand for ICRA training in all of your areas. So let's look at why we are interested in training the construction workforce in ICRA, or Infection Control Risk Assessment. Hospital infections. More than 2 million healthcare-associated infections are reported annually in the United States. And just to briefly explain, a hospital-acquired or associated infection is an infection where a patient receives the infection while in the hospital. So it's a secondary infection, not for the original intent for why they went into the hospital. And the second point is more than 100,000 of these inpatient deaths and an estimated cost of $30.5 billion in additional health care costs. So one of the things that we're also seeing is, according to a study conducted in the 1990s, 5% of these 100,000 inpatient deaths are attributed to construction activities occurring in the hospital. So what does this mean? This means that we're going to see an economic effect to the secondary infections in the hospital. And one other interesting note, another study showed that over 50% of the hospital-acquired infections that were caused by aspergillus, which is a mold-caused infection, were associated with construction maintenance activity. Let me give you some background. So why is all of this information on hospital-acquired infections important? That's because the Centers for Medicare and Medicaid Services, or CMS, stopped reimbursing hospitals for some secondary infections caused by the hospital. And also, some private insurers have followed practice and stopped reimbursements. With one understanding, though, that the list of the HAIs that CMS will not reimburse for are not all the result of hospital practices, related to construction activities, but the need for hospitals to prevent HAIs does have a financial impact to them. So hospitals have a need to control infections, and all of them have instituted procedures and practices to limit the HAIs. So infection control in the hospital setting is a large program to prevent the spread of infections. And according to the World Health Organization, infection prevention and control measures aim to ensure the protection of those who might be vulnerable to acquiring an infection, both in the general community and while receiving care due to health problems in a range of settings. That's hospitals, that's medical practices, dental offices, all sorts of areas. And the basic principle, believe it or not, the basic principle of infection control is hygiene. In a hospital or a healthcare setting, their infection control procedures include such activities as you can imagine as simple as hand washing, sterilization of equipment, disinfectant, and also PPE. Infection control risk assessment or construction activities that are related to ICRA are just one small contributor to the infection control program that hospitals implement. And just so to give you a little background, ICRA is a multidisciplinary, organizational, documented process that, after considering the facility's patient population and program, focuses on reduction of risk from infection and acts through phases of facility planning, design, construction, renovation, and facility maintenance. So as you can see, these activities are ongoing throughout a hospital. So there are no regulations, and I talk about federal regulations here, that govern ICRA as it relates to construction maintenance. There are guidelines that drive hospital compliance, and these guidelines are, for instance, the Facility Guidelines Institute, or the FGI, which is a not-for-profit organization. They've developed guidelines for the planning, design, and construction of hospitals, outpatient facilities, residential healthcare, and support facilities, and they require a safety risk assessment be conducted early in the design of these facilities. Also of note is many states require compliance with the 2010 edition of these FGI guidelines. Second, the Joint Commission. Approximately 77% of the nation's hospitals are currently accredited by the Joint Commission. And the Joint Commission standard, IC 010501, just a little number humor there, requires organizations to have an infection prevention control program. The CDC has put out prevention guidelines that many hospitals follow and other healthcare facilities, as well as the American Institute of Architects. As far back as 2006, their guidelines discussed design and development of infection control risk assessment. So as you can see, even though there's no federal guidelines or no federal regulations that govern ICRA, there are a number of organizations who have put out guidelines for us to follow. So let's talk about training. Because there are no regulatory drivers that are dictating ICRA training, the healthcare and construction activities have set the training standard. The unofficial standard on course length based on this contractor and hospital input is 8 and 24 hours. And why the difference between the two? 8 is being looked at as the awareness type training for workers, and the 24-hour is the worker course. And we'll talk a little bit in more detail about those in a second. I also want to mention that one of the misconceptions that's out there about this ICRA training is that it's being designed to teach how to abate these infections. And ICRA training is not about abating infectious diseases. That's a whole different line of training that folks need, if that's what they're getting into, that is above and beyond ICRA training. The other thing of note here that most ICRA training is patient-centered and not worker-centered. And what's meant by that is the goal of teaching a worker ICRA is to help make sure that their actions don't increase the risk of spreading infections to the patients or visitors or the staff of a hospital, not so much the protection of the worker while they're in the hospital. So let's talk a little bit about what CPWR has been doing in our activities as it relates to ICRA. First, at the request of the Building Trades Union, CPWR has developed an ICRA awareness training course. This 8-hour course provides training to understand ICRA procedures for properly performing healthcare or other occupied facility construction and renovation tasks. And I want to point out here, when I talk about other occupied facilities, what we're finding is many of the practices that is discussed here in ICRA can also be used in facilities that are occupied during construction and maintenance activities. So you can think about things like schools or office buildings, malls, other areas where there's a population occupying the facility while construction and maintenance activities go on, where by our construction activities, we may expose folks to an indoor air quality issue. So the CPWR interactive classroom-based training will provide participants with the opportunity to learn what is ICRA, the differences between hospital construction and regular construction. And that's very important because one of the things that workers have to understand when they're looking at getting involved in healthcare construction or maintenance is that their work environment that they're walking into is greatly different than our traditional construction environment. And so it has an effect on how their behavior and their actions have to be on the job site. Participants will learn about the hazards unique to healthcare construction. We'll learn about hospital-acquired infections. We'll also discuss the ICRA plan, which dictates how we work in these healthcare facilities. It'll go over the ICRA construction practices. It'll talk about some potential hazards to workers working in a healthcare facility. So in the CPWR 8-hour awareness course, we do try to focus on some worker hazards that they're going to be exposed to. And also we talk about interim life safety measures that always have to be considered when you're on a healthcare job. Also, the course does include a hands-on element where participants will examine the practical use of some ICRA tools, including things like containments, negative air systems, HEPA or HEPA filtration, and just some general work practices that are associated with ICRA control. And as of now, CPWR has conducted a number of train-the-trainers for the various building trades unions under the umbrella that we service. So let's look here for a second about the future. So what is CPWR's future as we look at ICRA? Our next task, also being given direction by the unions of the North America's building trades unions, is to develop a 24-hour worker course. So our next step is to build a course which takes the 8-hour course and adds on top of it additional information on barriers and controls that are needed to prevent the spread of infection. So what does that mean? The 24-hour course will look at training the workforce on how to build containment barriers, set up, I would say, fundamental negative air systems that will be used inside these containment barriers, and also work on some additional work practices such as inspection and maintenance of the containment barriers inside of an ICRA environment. The other direction that CPWR is working on is exploring the potential of developing a worker-centered standard. And what I mean by a standard is not a federal regulation through OSHA, but looking at things like ANSI or the American Society of Sanitation Engineers or some other organization where we can develop a standard that looks at ICRA from the worker-centered perspective, changing sort of 180 degrees to perspective what we currently see right now in the ICRA training, which is the patient-centered focus. Also, what's happening right now is the North America's building trade unions are very involved in CPWR's ICRA program. A subcommittee to the NAB2 Health and Safety Committee has been established, and we've been working together on making sure that we have everybody's involvement in this emerging topic. And I call it emerging only in the sense that you know, the training has really taken on new meaning over the last couple of years, even though ICRA has been around for a very long period